First of all, I would like to congratulate all the speakers for the amazing lectures, especially Dr. Jorge Moreno, because your class was amazing to treat IPL with IPL melasma. I agree with you with the treat the vascular compound to treat melasma with the other technologies and synergies. I'd like to introduce Dr. Víctor Ross. It's a great pleasure to introduce renowned dermatologist Dr. Víctor Ross from San Diego, California. He's a specialist in laser skin surgery, has conducted research on fractional lasers for acne scars and the use of IPL for the reduction of red and brown spots. He has won awards such as Joint Chiefs of Staff for Excellence in Military Medicine, was elected to the Board of Directors of the American Society for Dermatologic Surgery, recognized by the American Society for Laser Medicine and Surgery with the Caroline and William Mark Memorial Award, as well as the Leon Goldman Award. Currently the director of the Center for Laser Dermatology and Cosmetic Dermatology and the Scripps Clinic in San Diego. He also serves as associate editor of Lasers in Surgery and Medicine. Doctor, could you begin your magnificent lecture about optimizing M22 for pigment reduction?
Okay, I'm going to start here. I'm going to share my screen and we should be okay here. So I'm going to talk briefly about the use of the M22 Stellar system and the use of pigmented lesions. Pigmented lesions are the #1 thing that I see in my clinic. So when I talk about things that we see in San Diego or anywhere that's sunny, we have a lot of melasma, lentiginous, a lot of pigmentous And of course, if you look at the history of IPL from the early 1990s until now, it's become a very, very important part of the armamentarium of a typical dermatologist because it does so many things. And Luminous has been a big leader and a big developer in that technology. So we had the M22, and now we've transitioned into the M22 Stellar. The bigger differences are the bigger screen, the longer snout for the sapphire crystal, which allows you to have better visibility, a larger compartment to put things in. That's one of my big gripes about lasers is you have to have a place to put things like goggles and things. So Luminous looked at a lot of things that were probably imperfect about the M22 and addressed that with the M22 Stellar, which is quite nice. And you can really see the screen very nicely. So we know about the benefits of multi-application systems. You can just get a laser, for example, a pulse dye laser, and certainly that will do a lot of things, but it won't have the breadth of applications of something like the M22 Stellar. So the device works. The Stellar has this nice screen. Like I said, you can delegate it to some degree. It's versatile, has a lot of different hand pieces, 4 different independent hand pieces. Of course, the one we use the most is the IPL part because that's what pigmented lesions typically are going to respond to. So one of the great things about this device, and it probably has been addressed earlier today, is the range of filters and the range of crystal sizes. So you have lots of different filters, the typical filters, the 515, 560, you have the hair removal filters. We're going to concentrate also on the pigmented lesion filters, the short filters. So by picking the right fluence, the right filtering, the right pulse duration, the right pulse sequence, and the right sapphire crystal, you can really optimize this device to exploit multiple types of pigmented lesions. And here's the different applicators, the 9 interchangeable expert applicators, and we're going to focus on the ones that are best for pigment. So one of the unique things about the Stellar is this longer snout. By having a longer snout, you can see better. One of the pitfalls of the older system was you had to kind of hold your head to the side to see what you were treating. And by having this more extended, like a beagle, like a dog beagle instead of a snout for the nose, you can see much better. And then you have the 3 different crystals. You have the larger crystal, the medium-sized crystal, and the small crystal. And that allows you to, again, optimize the treatment depending on whether you're working in a concave area, a convex area, or the broad areas of the cheeks. So again, multiple applications, vascular, blue spots, and then finally pigmented spots. So again, if you look at the spectrum output of the various filters, the mains we use for pigmented lesions are 560 nanometers and 515 nanometers. You'll see that you can actually get very nice results for both pigment and vascular lesions. Pigmented lesions are actually easier than vascular lesions because with vascular lesions, particularly with the IPL part of the system, you have to be concerned about pigment. Darker skinned patients are challenged. The other nice thing about this technology is the generation of the pulse. So the capacitors are conformed so that you can get a very nice power that's very even. You have this even power as a function of time, which is not true for all other systems. So by doing that, the skin, particularly the epidermis, doesn't see this energy all at one time. It's sort of a smooth transition, which allows for better epidermal sparing. So the sequential pulsing allows you, again, to have the optimal ratio of epidermal to dermal damage. In this case, we're trying to damage epidermis, so actually shorter pulses are sometimes better. When you're trying to treat vascular lesions, you want to try to preserve the epidermis, have more cooling, and have typically a longer pulse or more pulses within your sequence. So again, you can do multiple pulses. Most of the system is set up for photorejuvenation with 2 pulses, and for pigmented lesions specifically in the presets for 1 pulse. So what's interesting is when you treat pigmented lesions, there are 2 broad areas. I guess it's 3 broad areas or 3 broad ways to treat pigmented lesions. You can use an infrared technology like the ultrapulse or the AccuPulse with very low settings to treat pigmented lesions, particularly very low contrast lesions. But if you're using IPL, you're treating with this histologic pattern on the bottom here. This is before treatment. This is roughly a day after treatment, 3 or 4 days after treatment, and then the restoration of the skin. So contrast that with a Q-switch technology. On the top here is a Q-switch technology, a Q-switch ruby laser. And here you see this immediate vacuolization at the dermal-epidermal junction. So the good thing about longer pulse IPL technology is you have this sort of gentle heating of the skin and this very slow desquamation. And it tends not to be a violent type of reaction, so that with the exception of melasma, it's very rare to see post-inflammatory hyperpigmentation after IPL. Which is not always true for Q-switch lasers, whether that's Q-switch Ruby or Q-switch 755. So here's a typical patient that you'd see before and after from Dr. Remington in Canada for pigment. Here's one of my own patients. So it's a typical patient we see in San Diego, and this is true for any sunny area, a Caucasian patient with type 3 skin with this mottled pigment. And again, the critical thing when treating pigment is to get the right fluence and the right pulse duration. And the presets on the M22 Stellar are actually quite nice. If you use the presets and you just choose the rejuvenation settings and you choose the amount of pigment, and typically we're using the 560 nanometer filter for the face, sometimes the 590 nanometer filter for the chest, and you pick the right settings based on that, you're going to be good. The critical thing, of course, is to account for a tan. The skin typing system is based on your ability to tan. And of course, if you have a tan patient, you have to make that conversion in your head from, say, type 2 to type 4. So this patient might be a type 3 patient or type 2 patient if you were treating psoriasis, for example. But if this patient comes to your clinic and she's tan, you might have to transition to type 4 settings. So skin typing is not as important as skin color. So your eyeball has to be attuned to the actual real-time skin color for that patient for that particular day. Here's one of our other patients, and this is what we see in San Diego. This lady is only about 52, but her skin is probably about 65 years old as far as her sun age. We have sort of our chronological age, but then in San Diego, almost everybody looks older than they probably are compared to New England, where everybody tends to look nice and pristine. So you have a variety of pigment lesions here. You have low contrast lesions, like this lesion, then you have so-called high contrast lesions, which are these very dark lesions. And of course, the low-hanging fruit or the easier lesions are these very dark lesions. But again, you want to be aggressive enough to get a good result in one treatment, but not so aggressive you have blisters or severe crusting. And that's the trick with any device, including M22 Stellar, is to become intimate enough with this device so you in your head can pick the right settings and pick the right presets based on the skin type for that particular day. So this is what you want to see. Here's one of my own patients. We treated her with a 590 nanometer filter. So we basically chose type 4 non-facial settings. The way the device is set up, when you do the rejuvenation settings, it lowers the settings and extends the pulse duration for off the face, which is exceptional and it's actually correct. So typically you're going to go down about 15 to 20% when you move from the face to off the face. And this is what you want to see about 20 minutes later. So one thing I do oftentimes is I will do a test spot, say up along the clavicle. I pick the darkest area. I do a test spot, sometimes with a little mask, and then I put numbing cream on, and then I come back. And when I take the numbing cream off, I look at that test spot and maybe 2 or 3 different fluences, and I pick the one that's best. And then I can proceed confidently for the rest of the session and not worry about over-treating. I think we've all over-treated a chest or a face using IPL, whether it's this IPL or another. And then you're hand wringing, you worry about infection, you're worried about scarring, you're worried about striping. So you want to get aggressive enough so you get a nice result, but not so aggressive that you over-treat. Here's that same patient before, and this is after one session about a month later. And so the next session, you may increase your settings. We always tell people after the first session, wear a crew neck shirt. I really think everybody needs to wear crew neck shirts. I think that V-neck shirts be banned in America. I want our mayor to say no V-neck shirts and have a fine if you wear them. But most of our women in San Diego, and probably like most areas where it's sunny, women like to wear V-neck shirts, which keeps us in business, but it also causes a lot of this dyspigmentation. So that's a nice result. Here's another result from one of my colleagues, Dr. Palm, who lives right down the street from me. Hands can be treated as well, anywhere where there's pigment, and everybody has a brown spot. I think if you look at 2 things that everybody has in life after age 40 is a brown spot and a scar. So you have to have devices that treat a brown spot and a scar. Not everybody has broken blood vessels, but almost everybody has a brown spot and a scar. Here's one of my own patients. This is an Asian patient. A lot of people say, oh, you can't treat Asian patients, you can't treat Hispanic patients. And that's a large part of what we treat here in San Diego. Here's a patient, we did the M22. We chose the type 4 facial settings, which gives you 16 joules per centimeter squared, a double pulse, about 30 milliseconds total long, and the 560 filter. And this is after one session. Again, this lesion didn't respond completely, but pretty darn good. And this is after one treatment. And these are pictures I show patients. When I had my consultation, I show a patient a picture like this and say, this is what we expect after one treatment. We don't expect every lesion to be gone, and we certainly don't expect every lesion to stay away forever. A lot of people want a lifetime guarantee. They want one treatment, every lesion gone, and for eternity. And I tell people that's just not the way it is. That'd be like mowing your grass one time and you never have to cut your grass again. And that's not what real life is all about. So here's a video of us treating a pigmented lesion. And we try to take the small spot. So one of the nice things about this device, let's say you've used a big 15 by 35 millimeter crystal, and now you've gotten some of the darker lesions, but these lighter ones are still there. Then we can take the little 6 millimeter crystal. We can convert to the pigment lesion mode, which gives you a much higher fluence, often as high as 19 joules per centimeter squared or 20 joules per centimeter squared with the 515 nanometer filter. But now you're only confining the treatment to the spot. So if you over-treat a bit, you're okay because you're just putting it on that one spot. You're not going to have a massive burn. So it's very nice for these low contrast lesions. If you don't have a Q-switch laser, you can be very aggressive with a 6 millimeter spot and get very nice results. And here we are again, just treating somebody for a lesion here, a little brown lesion. So we take the little 6 millimeter spot, and that way we can put it right on the spot, and we can just hit individual low contrast lesions that did not respond to the bigger session. And that's a good way to pick off these low contrast lesions. So when you go to the pigment lesion mode, the pulse duration becomes very short. This is only 4 milliseconds. With the typical rejuvenation mode, you're up around 15 to 30 milliseconds. So now we're compressing the pulse duration, which stresses the epidermis and causes a more rapid temperature rise. But we want that here because now we're using that small spot, and that's why the fluence is so high, 19 joules per centimeter squared with a 515 nanometer filter. And I have to say that Luminous has done a very nice job with these presets. They're actually pretty much spot on. They're not too aggressive and they're not too light. So if you choose the right skin type, and I like to, when I talk about skin type, I like to talk about skin type equivalent. When I say skin type equivalent, I mean it's based on what that patient looks like that day. So again, I can't emphasize too much. If you have a tanned type 2 patient, I convert that patient to a type 4 patient for that day when I choose the settings on the module here. And that way I'm pretty safe. The biggest reason we really see lawsuits in the United States with IPL, regardless of the IPL, is somebody using presets based on an untanned setting. So you have to be very careful about that anywhere where it's sunny, which is most of the world now, I think. And so here's a low contrast lesion right here, right below this area. We had done the resurface here, and here we had a few low contrast lesions. We used the small spot, and this is what it looks like about 10 minutes later. And that's the endpoint you want with any long pulse technology for pigment lesions. You want a little bit of darkening after about 10 or 15 minutes and a little very small remnant of perilesional erythema. That's the endpoint you want to see. Now, another way to do this, if you want to use the big crystal and you don't want to switch crystals, is you choose the lentigo setting, epidermis, and use a little mask. You can take a little plastic mask. You can buy these from different companies. You can make your own. And that way you can only have like a 6 millimeter hole or 3 millimeter hole. And that's another way to do low contrast lesions. So you can put that right on this little lesion here and pick that off without exposing the whole area to that bigger fluence in that bigger spot, because all of our patients here, probably like most of where you're living, are tan year round. I mean, most of our patients they're bronze year round. They always have some pigment. Nobody is lily white here. So we're constantly battling with trying to pick off these low contrast lesions. I also point out to patients, a lot of patients have a mixture of lentigines and nevi. This is a real nevus here, a real mole. And we tell patients, generally speaking, we're not going to treat the moles. And I show them that those moles will not go away. I also tell patients, particularly on the arms, many of these patients have idiopathic guttate hypomelanosis. And I tell them, look, that's not going to get better. And also take pictures, because some patients will claim you caused the white spots after the treatment. So getting to melasma, I'm not going to spend too much time on melasma. I know one of the previous speakers addressed it. It's a very challenging condition, as you know. It's something I hate to walk in the room. The nurse says you have a melasma patient. I go, I throw my hair out, because there's so many tough things to do. So we generally use very low settings. The M22 Stellar does have some dedicated melasma settings, and they're quite low, and the pulse durations are quite long, which I think is good. It has to be done conservatively. Sometimes we'll combine it with very light 1565 fractional. We always add bleaching agents. We can use the Q-YAG module occasionally, and we use a lot of oral tranexamic acid. So melasma is really a lifelong condition. It's like diabetes or high blood pressure. We don't cure it. We try to control it. We try to manage it. And that's where we are with melasma. So real quick about the resurface, because that's oftentimes, I think, not looked as much as it should be for pigment. The nice thing about the resurface is you can go very low settings and actually enhance the result of the IPL part for pigment, whether it's melasma, but more often than not, it's just this background low contrast lesion. So you can actually use settings like 20 millijoules and 200 microbeams per centimeter squared and go across the whole face. It takes an additional maybe 8 or 9 minutes, but it's probably worth it. It has the continuous cooling, which is nice. And again, here it doesn't matter how dark the skin is, because as far as the pigment, because you're just randomly placing these dots. So it's a nice way to pick off some of the low contrast lesions in the background that you haven't picked off with either the small spot or the big crystal with the IPL part, with the 515 or the 560 or the 590 nanometer filter. Lots of different patterns. You can get lots of different patterns, which is nice. And again, the scanner, you can see here, kind of a random scanner, which is nice, and it's fairly comfortable, certainly much more comfortable than the Fraxel device with the same types of settings, which is nice. Here's it again working, and there. So the applications, again, dyschromia and lentigines for 1565. You can, again, it's like a turbocharger for the IPL part. It doesn't have to be used all the time. I think when somebody wants some tone and texture improvement and they want improvement in lentigines, it's a good way to go. And here's somebody before and after. This is Dr. Clementoni. He's on the panel. You see nice results with that. And in scarring, Dr. Clementoni as well, which also oftentimes has pigment. Now, I have a lot of other favorite combinations that I use that's all involved with luminous technology. Just yesterday, for example, my last case of the day, I did light active FX on the whole face, 100 millijoules, density 1. I did the M22 over the whole face for pigment and vessels. And I did a little higher resurfacing settings with the ultra pulse here. And that because a lot of women come in with sort of a mixed presentation. They have lentigines, they have telangiectasias. They just want some very light resurfacing. And you can either use the AccuPulse and feather touch mode, or the ultra pulse with very low settings and get very nice results in combination with the M22. It's a nice way to combine things like peanut butter and jelly. Peanut butter and jelly goes together very well, and that's true for the IPL and the 1565 resurfax, as well as the ultra pulse or AccuPulse. So there's a lot of very creative combinations you can do with all of this luminous equipment. Here we are, we had just done the M22 yesterday, and at the very end, we use the ultra pulse for the little wrinkles around the mouth. And that way people get the whole package. They get sort of, the whole enchilada, so to speak. They get the wrinkles around the mouth, and they get also the pigment and some of the vessels all in one session. Because most people don't come in just with lentigines. Almost everybody who has a lentigo also has a wrinkle, also has a telangiectasia somewhere. So post-operatively, for most of the M22 patients, just very light sun protection, very light moisturizer. We oftentimes use clobetasol if it's a darker skin patient for 5 days afterwards. We give it to them in a little cup. We squeeze it out, put it in a little cup. We have them use it at home twice a day for about 3 to 5 days, just to suppress that immediate tendency to post-inflammatory hyperpigmentation. We only do that for our darker skin patients, usually type 4 and 5. I do think it's helpful, particularly with melasma. There's a good study out of Asia that shows it's somewhat helpful. It's certainly not perfect, but I think it helps. Anything you can do to suppress inflammation after these treatments is helpful. And again, just to showing how fast things are with this machine, if you're just changing from one to the other, and we just start the initiation of the sequence here, and now you see the filter. So it's very easy to change filters. So if you're going to darker skin, you may change from the 560 to the 590 nanometer filter. You pick the presets. We're always choosing the rejuvenation setting, and that's basically what we're hitting. And then we hit shallow, and then we give our setting. For example, this is type 2 settings. It's going to be 17 joules per centimeter squared, a double pulse, about 20 milliseconds long total. And so we really use the presets, and they, like I said earlier, they're pretty darn good. We usually use a little supplemental air cooling level 1 or so with the Zimmer just for comfort. And again, this is what the panel looks like. It's a little bit sophisticated, but once you get used to it and navigate it, it's relatively intuitive. I don't think any of these systems are completely intuitive, but we're getting better and better with that. And this is changing the crystal size. So we had the larger size, so it's very fast again. And now we're switching to the smaller size. So it takes about probably 45 seconds to change from the big crystal to the small crystal, pretty darn fast. And again, you just have to make some little buttons on the panel, and then you're ready to go from a big area to a small area and focal length. Have your test spot always at the darkest area to be treated. So usually the clavicle or the upper cheek. Don't choose a lighter area. Then put the numbing cream on. Then you want to go maybe 30, 45 minutes later when you take the numbing cream off, and treat usually a little bit less than the test spot. You can use multiple masks also for test spots. We talked about the little mask with the hole in it. And you want to look for darkening of the lesion and a little low contrast lesion. And so these are things you can do for low contrast lesions. You can short of wavelength filter or decrease the number of pulses. Now you don't want to see this. This is what you will have if you overtreat. This was one of my colleagues down the street who again treated this patient like a type 2 patient, but in fact she should have been treated as a type 4 patient because she was tan. And this ruined her summer. Her husband had just bought a boat. They were supposed to go out and have a lot of fun for the summer. This was May about 2 years ago. And, it kind of ruined her summer. It went away. It took maybe 6 months. It goes away. But nobody wants to have this because it's bad for your reputation when you go out in town and people ask, who did that? And it's you. So don't be you. Don't be that guy. So if you go too high, you're out of the game. And that's the way it is with IPL for pigment. You don't want to ever go too high. Always take a chance being low. Leave a little bit of headroom. Even if the patient's disappointed because maybe not every lentigo went away, you can bring them back a second time. And this is the endpoint you want to see after about 20 minutes. This is before. So most complications from IPL, whether it's the M22 or another IPL, is not knowing the device well enough. You need to use the device every day. You don't have to take it to dinner, but if you want to take the M22 to dinner and have a nice dinner, that'd be a good way to sort of bond with it and actually even know it better. You should know that panel well enough that you can just know where the buttons are without even looking at the panel. And when you know it that well, you and your M22 will really do better together. Thank you very much.
Dr. Víctor Ross, I have some questions for you.
Sure.
First of all, what do you think of this high parameter, Dr. Cesar Gonzalez, would you like? If it is adequate for our population, because the most people here in Latin American is phototype Fitzpatrick phototype 426. What do you think about this?
You mean with the small filter or the small sapphire window? You said high parameters, so I'm not wasn't sure what are you referring to when you say high parameters?
Okay.
You mean aggressive setting?
115, for example, in 18 or 19 joules is so
Yes.
high. It's so high.
Well, okay, that's a good question. So if you're really that, you wouldn't use that on somebody with type 4 or 5 skin, because that would be probably too high. You could go down to 13 or 14. I was showing that as kind of a Caucasian with lighter skin who has a light lentigo. And you can always adjust that down. So you might start at 11 or 12 with a 4 millisecond pulse if somebody had darker skin. And the critical thing, of course, is just confining that energy to the spot. So don't go beyond the spot. And that may require using a mask, because some lentigos are smaller than 6 millimeters. If you have a 3 millimeter lentigo and the spot's 6 millimeters, and you treat type 5 skin at 19 joules per centimeter squared in 4 milliseconds, yes, you're going to burn that whole area. So that was for type 2 skin. Yeah, you'll have to go lower if you go to darker skin. You always have to appreciate the background skin, and you have to cater to the background skin to get the optimal settings. The problem is a lot of patients, they come back and they complain that one lentigo didn't go away, and they'll invariably say that's the one lentigo they cared about the most. I always have people do that. Like, every lentigo goes away and there's one that doesn't go away. It's usually a lighter lentigo, and they say, gee, that's the only one my husband didn't like, and you didn't get rid of it. You're a complete failure. So then you have to go back and take that patient and then go a little higher. But it's all within the context of the background skin. You're exactly right. You can't use very high settings with type 4 and 5 skin.
Regarding the IPL treatments, it is possible to combine different wavelengths in the same session. Is there a limit for the number of passes? What is your endpoint?
Sorry, I missed the first part. So endpoint for for combining sessions with what?
Regarding the IPL treatments, it is possible to combine different wavelengths in the same session. Is there a limit for the number of passes? What is your endpoint?
Yeah, so I guess you're saying if you did 2 different filters in the same session, like maybe the 560 filter and the 515. Yeah, I mean, normally you would go over the entire face with the more conservative setting. So maybe, depending on the skin type, say type 3 settings, facial settings, 560 nanometer filter, and then come back with individual lesions with the 515. You can do as many passes as the endpoint will allow. The endpoint, though, is this darkening of the lesion and a little redness around it. Now, I guess the one pitfall with that is it takes a while for that change to be obvious sometimes. So if you treat and you think that you haven't treated aggressively enough, that's why I like the numbing cream thing and doing the test spots if you're not sure about where to go. With more experience, you won't have to do the test spots. But when you're an early user, doing the test spots is very helpful, because it takes about 20 to 30 minutes to see this evolution of the darkening of the lesion and the little redness around it. Sometimes a little less, but I've been fooled before where I thought, gee, I didn't treat aggressively enough. At a patient a week and a half ago, I did a test spot on the back, and her upper back was somewhat tanned. And I thought, well, this setting's very safe. And I did a little test spot, and when I took the cream off, I went, wow, I'm glad I didn't, because it didn't look bad at first. But after 45 minutes, it was completely red, the entire imprint of the sapphire crystal. And you don't want to see that. You don't want to see the entire pattern of the crystal all red. So I adjusted the fluence down by about 20%. So you have to always be careful, because it takes time for the endpoint to evolve. Now with blood vessels, it's very easy because you see the endpoint right away. But with pigmented lesions, it can take a little while to see that endpoint.
Okay. Thank you for your amazing lecture.